Can I just start by saying how excited I am to be here, being able to have this conversation with you.
Thank you.
At Endeavor Health, we long ago made the commitment to lean heavy into the genomic space and are one of the largest primary care-based genomics programs in the country. So I know we share a fundamental belief that genomics should be available to everyone, and that through genomics, we have the potential to unlock incredible potential in creating more engaged and personalized healthcare experiences and really impacting care. So I can't wait to dig in to your story at Tempus. The introduction, your bio, reads like a resume of tech startup success. Want to lean a little bit into your current experience at Tempus, genomics, tech, data, AI, the intersection of all of them. You've pretty much hit every buzzword in the industry. So well played and well planned, my friend. A visionary indeed.
Thank you.
I know your story, like many founders, starts with a personal experience. Can you talk a little bit about what brought you to the idea and founding behind Tempus?
Yeah. Can everyone hear me okay? So first of all, welcome. It's good to be here, and thanks for inviting me. In terms of my experience, I mean, I have been building tech companies in Chicago since '99, and so I had kind of a series of businesses that I had started. But in particular, my history was a bit odd in that I kept starting a new tech company in a new industry, and so I had to learn a new space from scratch. So whether that was the printing industry or that was logistics or media buying or local commerce, I kept kind of bouncing around, getting consumed by some problem, getting fixated on solving it, and then having to learn an entirely new industry. And I used to say to people, the only two industries I'll never go into are banking or healthcare. In large part because they were just super regulated and felt super slow and super miserable. And so, but about 10 years ago, my wife was diagnosed with breast cancer, and so I found myself spending a bunch of time in a clinic. And I had this really weird experience in that she had incredible access to the best doctors in the country, and I would constantly bounce every decision off of this dream team of breast cancer oncologists, and they would never agree, and they all had data supporting their opinions. And even though they were minor nuances, they were nuances. And so at the time, genomic sequencing was gaining some scale. We sequenced the human genome a little over 20 years ago, and this was about 10 years ago, and so it was gaining some scale, and it was making it even harder to figure out what to do with treating cancer patients. And so I just kind of had this aha moment where I thought, this feels like the kind of problem that technology, and in particular machine learning and AI, is ideally situated to solve, which is taking lots of different disparate data sets that are heterogeneous in nature and then trying to find some common path forward to help physicians make data-driven decisions in clinic. And so, she did great, and she was treated and did great, but I had that kind of moment where I realized I need to stop doing whatever I'm doing. At the time, I was CEO of Groupon, and I need to just focus on this problem. And I wasn't sure if it would be a nonprofit or a for-profit, but pretty quickly we realized that it was going to be a business, and that it would probably be a big business, and that the world needed AI in healthcare, and that AI in healthcare would probably start in diagnostics, and we found ourselves kind of at the epicenter of it.
Can you give us a little more into the value proposition of Tempus and how you use and deploy AI to unlock actionable information and insights?
Yeah, I mean, so at the end of the day, Tempus is focused on this category called AI-enabled diagnostics, or how do you make diagnostic tests smart? And the inherent challenge is that you have to contextualize the information in order to really personalize. So we talk about personalized medicine, but in reality, it's not personalized. So our big challenge was trying to figure out a way to connect, in our case, genomic sequencing, which is the diagnostic most commonly used in cancer, to clinical data for that patient. and then contextualize the result. So what does that mean? It means if I sequence a patient and they have a particular mutation, it isn't personalized to recommend a drug that patient took in a prior line of therapy and failed. It isn't personalized to recommend a clinical trial that patient isn't eligible for. It isn't personalized to fail to recognize an adverse event which actually could be more detrimental to that patient than the drug you would recommend given the mutation you found. And yet there was a complete disconnect between the genomic data that was being generated and the clinical data that existed for that patient. And so what Tempest sought to do was marry those two in real time. So we built a lab to sequence patients, and then we built technology to suck data out of the EHR or wherever that data resided, to structure and abstract that data in real time, meaning a matter of days, connect it to the molecular data or the sequencing data we were generating, and then have the laboratory test result itself kind of recontextualize around that patient. So doctors didn't have to try to figure out how to interpret it for that specific patient. It was already interpreted for that specific patient based on their data. And, this might seem simple, but it's super hard.
It doesn't seem simple.
Yeah, it's super hard. And almost immediately, we knew we were onto something. We pitched this idea to Northwestern and City of Hope and a few others, and Northwestern signed up, and then Rush signed up. But we knew almost immediately that we were onto something because the growth of the company was extreme. And you kind of, when you see that kind of tailwind, you know you've solved some kind of problem and you have product market fit. And so Tempus began to just explode. And I mean, if you look at it from kind of where we were, we opened the lab in 2018. At this point, we're the largest sequencer of cancer patients by a wide margin in the United States. I mean, we'll be, much, much larger than number 2, who's much larger than number 3. And our growth rate is significantly faster. So we're now the largest and growing the fastest. And it's, again, a function of the fact that the smarter these tests get, the more doctors rely on them and need to rely on them, the more orders they're placing, and the whole thing creates this really positive flywheel.
Amazing. Incredible growth in an active space, success from your company, yet there continues to be a significant gap in both clinical adoption as well as access to genomic services. What do you think will be the biggest factors in closing that gap and supporting wide-scale adoption?
Yeah, I mean, well, it's on the right trajectory up. I mean, if you look at sequencing, let's say 10 years ago versus sequencing today, there's been significant growth in the industry. It's been growing about 25% a year for the past decade. We've been growing significantly faster than that, but there's been a lot of growth. And what propels that growth is that, and this started in cancer, but it'll be pervasive in all disease areas. The more patients we sequence, the more molecular data we generate, the more that data finds its way into publications and clinical trials and research papers and ultimately drugs. And the more drugs that are connected to a particular biomarker, meaning they're kind of tailored around some kind of biomarker, the more you have to sequence. And so that kind of dam broke in oncology. And so we used to say about 1/3 of cancer patients were sequenced once in their cancer journey, which on average is about 3 years. Essentially, 600,000 people get diagnosed with cancer a year. 1.8 million people get diagnosed a year, 1.8, 1.9. About 600,000 die. So on average, cancer patients live 3 years. They live longer, but just average. And so we used to say, essentially, a cancer patient was sequenced about 1/3 of the time every 3 years. But that is growing pretty dramatically. I don't know the current stats today, but it's significantly higher than that. And with all these new tests that are available, whether it's inherited cancer risk or liquid biopsies or solid tumor profiling, or most recently what they call MRD or minimal residual disease detection, I wouldn't be surprised if in the next 5 or 10 years, 2/3 of cancer patients are sequenced like twice a year. So it will have migrated over a decade from, let's say, 1/3, 1/3 of the time to 2/3 biannually. So it's up and to the right. And companies like ours, one of the advantages we have is we don't have to set limits on who can be sequenced. We can afford to have the most favorable financial assistance policies that you're allowed to have legally. We can afford to broadly market our test to all cancer patients without having to pick one particular area. And so that's opened up the landscape pretty broadly.
I want to go a little bit deeper on that theme of I'm hearing the more data in, the richer the insights out. Interested to hear who have been the early adopters in leaning into this space, and what are the segments that you next want to bring into the fold to really enrich the value of that data set?
Yeah, in our case, the early, when we started pitching Tempus, we started pitching it to academic medical centers. And so there's 72 NCI cancer centers in the United States, and we're the largest outside sequencer for 50 of the 72. And so academic medical centers, in particular NCI cancer centers, I think leaned in first. But at this point, Tempus has around 7,000 regularly ordering oncologists, and there are only 14,000 in the United States. So, I mean, we now have people ordering our tests pretty broadly. So I think kind of everyone's leaning in. The challenge is, for us in particular, we're sequencing a ton of patients, which is great, but we're also generating an enormous amount of multimodal data. So, you're talking about basically molecular data connected to clinical data, connected to radiology scans and pathology slides, and it's become an enormous amount of data. It's approaching 250 petabytes of data, and it grows by, 20 petabytes a month. So you're getting to a scale of data that's kind of crazy, where it's not uncommon or to think that a company like Tempest will have an exabyte of data in a few years, and a few exabytes after that, and then a dozen exabytes after that. And the challenge with a company like ours in particular, when you have so much data coming in, is you have to, in order to deliver these insights, if you think about what Tempest does for a living, we have this proprietary data set, and then we generate machine learning or AI insights, and then we deposit those insights into the hands of a doctor when they're making a decision. Well, that has to happen in basically real time. So you have to run compute on enormous amounts of data. So some of the challenges that we grapple with are unresolved today. Like, I mean unresolved. Like, there's no one that has resolved them. As in, Google doesn't know how to solve this problem, and Microsoft doesn't know how to solve it, and no one knows how to solve it.
It's a problem that needs to be solved. Pay attention.
In large part, not because you can't solve it, but in large part because the cost is prohibitive. Like, you can't run compute on 12 exabytes of data in real time. It would cost you like $3 billion that day. So you can't do that, because that'd be an expensive day. So you have to, the core technologies that allow us to basically run compute at scale have to pick up dramatically so that companies like ours can actually run compute at that scale.
Interested in your perspective in the diversity profile of your data set. How important is that, and what do you see as the role of the company, the industry, in enriching the diversity of the data?
Yeah, I mean, I think so one of the things that scale affords you is when you have the kind of scale we have where we sequence for half the country, you have diversity, right? It's a law of large numbers. Like, for example, Google's a very diverse search engine because it has like 90% of all US. It's like at some point it's very diverse. So we're benefiting from that same scale where if you look at our data set by percent distribution, it really mirrors the US, other than there's a few anomalies that are systemic to the healthcare system, not systemic to our data. But at the end of the day, we pretty much mirror the US. And then we have a whole bunch of programs that I think are actually, they weren't designed with diversity in mind, but they're very good for diversity. So one of them is, when we got to this scale, as Tempest began to kind of explode, and more hospitals were signing up, we have I think it's like roughly 2,400 hospitals in the U.S. connected to Tempest, feeding us their data. There's only 5,500 hospitals, give or take, in the United States. So once we had all these hospitals connected, there's a few things we could do that nobody else before us that had that scale could do. And one of them, which is part of our apps business, is we could deploy technology at the provider that could really do two things. One, it could figure out if the patient was on the right drug and close a known care gap, meaning the standard of care says you should do this, every doctor would agree you should do that, and for whatever reason it's not happening. And that is a care gap you want to close. But the second thing that we could do is we could find patients who were like a perfect match for a clinical trial in real time. And because these patients are kind of needle in a haystack, we could convince biopharma, in particular the sponsors of these trials, to open up the trial at that community site in a just-in-time manner. And so basically every day, we open up a new clinical trial at a new community site that's never had that trial open in an average of 10 or 11 days. So we're basically bringing trials to where patients are. Now, that just happens to, as a byproduct, really help diverse populations where people can't afford to travel, let's say 100 miles or 200 miles to get to an academic medical center. But it was designed not with that in mind. It just happens to be an end product that's, positive.
Interesting, and that scale unlocks opportunity. Was there a point in the trajectory of the growth of your company where you hit that flywheel where the opportunity just kept coming? And I think everyone wants to know, how'd you get there?
Yeah. I think it's very hard to recognize that moment. Certainly we've had the flywheel of adoption moving in our favor, and it moves in our favor all the time. And I think there was definitely a point, and I can't remember when, but when we first started pitching Tempest to people, we would walk in and say, these genomic tests are really hard to understand. Your oncology is about to be the first medical practice that breaks by virtue of an inability for doctors to dissect that amount of data in real time and make a decision. They're going to need help. If you use us, we'll give you that help. But you have to give us clinical data for your patients because we can't marry these things and help you make data-driven decisions without the clinical data. So we'd walk in and we'd say to people like, hey, we're going to sequence your patients, but oh, by the way, you have to give us all the data. And we need to keep a copy of it and be unrestricted because we have to figure out how to use the data. And it's really expensive to mess with the data, so we have to at some point make money or we're not sustainable. And that was a really hard message originally. But there was definitely an inflection point where enough hospitals had said yes that it became really easy for the next hospital to say yes. But I can't remember when that was, and certainly early on, it was a pretty tall mountain to climb. But I think the way you get over that mountain in this issue or any issue is the ultimate value you're delivering and the problem you're solving has to be good enough that people are willing to endure some amount of pain to adopt your solution, whatever that pain is, whether it's change management, whether it's giving someone the data, whatever it is, paying for it. So in our case, I think our solution was pretty good. And so people started saying, I'll adopt. But it's often hard to see that in hindsight. And when you're building a business, generally speaking, and I tell this to people all the time, like building a business is like raising a kid. It's never like a big thing. It's a million little things, and it's every day, and it's little tiny pivots. You don't look back and be like, I made these 3 good decisions, and that's why my kid's a great kid and is going to Harvard or whatever. Like, there's never that. It's like a million little tiny things. And so I think you have to just, when you're building a business, pivot your way through all the things that don't go well till you find product market fit.
Okay, I have to ask, you leaned into healthcare, a space of incredible opportunity, but highly regulated. I come from healthcare, but I'll admit, not necessarily known for our ability to move fast. I've been told selling into healthcare systems isn't always easy and takes a long time. Any lessons or things that you learned from moving into a space like that?
Yeah. I thought I would hate it, but I've actually loved it. So let's break it down. So first of all, it's a really smart space. So at the end of the day, I spend my life dealing with physicians and CEOs of hospitals, and it's a very intelligent space, and it's also a space where people really want to do the right thing. As stoic as they are, as afraid of change as they are, whatever, all the
Fun sometimes too.
yeah, but they really want to do the right thing. They really want to help patients. They really want to do the right thing. So I found it to be a great space. The regulation side of healthcare, I think, has moments of brilliance and moments of absurdity. Like a moment of brilliance would actually be HIPAA. So, so we talk about, for example, privacy a lot, but HIPAA is one of the great instances where I think U.S. regulators got it pretty right in terms of how you can ingest data, what you have to do to de-identify it, what makes it de-identified, how you can basically transfer that data. There's a whole bunch of rules around that data that don't exist, for example, on the internet. And I've said this also to people, like, if I give the average person the choice of having their healthcare data, all of it, every single ounce of their medical record, run on like the NASDAQ ticker in Times Square every day for a month, just scrolling. Or every search you made on Google, even incognito mode, and everything you said to Siri, and everything that you said to whatever, Alexa, like you pick. Like no one will pick that, okay? So, and by the way, all that data is unrestricted. And you can think you're protected, you are almost never protected. You only find that out when like, there's real problems and people actually can kind of unblind everything you thought was blinded. So all the really bad stuff that we do every day is like running around out there, but the fact that I'm depressed or whatever is pretty tightly locked. And so I actually think it's a great example of how people did it well in regulation. Now, on the flip side, there's a series of very weird regulations that make no sense in terms of inducement and Stark laws and division of church and state and the FDA and how drugs get approved. And there's lots of really, odd laws in healthcare that you'd look at it and say, this makes absolutely no sense. But in general, I think the industry has been great and people are smart and want to do the right thing.
Well, and I will say as someone that lives in that space, that regulation, those restrictions, the complexity of the problems is exactly why we need people like those in this room leaning into and coming up with creative solutions. Tempus, not your first rodeo. You have successfully scaled companies across a variety of different industries, digital, media, logistics. Is there a common through line in all your ventures in terms of problems you're trying to solve or solutions that tie it all together?
I don't think there's a common theme other than the fact that they're all problem oriented. I've also say this a lot. Like, if you're building a business and you're trying to get rich, you're screwed. Like, that's a terrible philosophy. It's like going out saying, I'm trying to get married. Like, that's the only way you won't find a husband or a wife is to go out and say, I'm going to get married tonight. Like, that's a bad approach. You have to, I think, be focused on a problem and solving a problem. And I'm lucky that I get maniacally focused on problems and solving problems, which I think allows me to, generally speaking, build good businesses because they're not designed to make money or whatever. They're designed to solve a problem. Now, along the way, with most businesses, you have to find a way to be sustainable or your problem-solving days are going to be over. But in general, like, we at Tempest don't spend a lot of time focused on like money and things of that nature. We spend a lot of time focused on why is this not working? What do we have to do to make it work? How do we fix this product? How do we get more scale, more adoption? And I think if you look at everything I've done, I'm always trying to solve some problem. And by the way, some of these problems I don't solve and they just hang out in my head. Like, even though I am no longer involved with Groupon other than I'm a giant shareholder, somewhere in the back of my head, that problem's still gnawing at me. And will gnaw at me like forever. I mean, I get to kind of mostly move on, but any of these unresolved problems, they just sit out there. Like, what could you do to make this work? Why isn't this?
Do you sleep
clicking?
at night?
Yeah, I sleep well, but I also drink a ton of alcohol. So at that point,
Oh, that might be some of the best advice we've received
yeah,
here.
probably helps. I don't know.
Eric, so I want to pivot a little and delve into some of your experience to share some of your earned wisdom with the other founders in this room. We know key to scale is really knowing your customer and being able to build a following. Any tricks or things you've done to really understand your customers deeply?
I don't think there's a trick per se, but I'm kind of shocked by the number of people. Now we also invest in quite a bit of early stage startups through Lightbank, but I'm with people all the time pitching clients, and I'm shocked at how often people are not attuned to what the customer is saying. They're not absorbing it. They're like they have their own view of the world. They have their own pitch. They have their own whatever, and they're just not seeing the objective signs that this person hates what you're saying or doesn't want what you're selling or doesn't believe what you built. And so I think, being self-aware is probably the single biggest thing people can do when they're building a company, because it's just too easy to kind of go down the wrong path and then fall off a cliff. The other thing I think people can think about when they're building a small company is, what are the objective markers and milestones that would lead to success or failure, and how do you put those out there? And this applies also, by the way, to like selling stock. So, I'll give you like the Bitcoin example. So I was fortunate to buy a lot of Bitcoin really early, and I have there's a guy that is in our office who runs this little fund of ours called Lightblock, which is largely a blockchain fund, and so we have a bunch of like Bitcoin, Ethereum, whatever. So, and he and I are philosophically aligned, and where we've done incredibly well is he will and I will, we both will, but he will sit down and say, okay, Bitcoin went to 60,000, let's say, and now it's down to 20. But when it's at 60, and let's say we sell some or all or a big chunk, whatever, he will say, okay, we would buy at 20 or 30. And here's how much we would buy. And then if it went to 50, we'd sell this much. If it went to 80, we'd sell that much. If it went to 100, we'd sell that much. And you kind of write down that. It's going to be the same thing with a stock. Doesn't make a difference. And if you follow that, if you just don't deviate, you'll be amazed at how well you do. And it's amazing how many people deviate. Like when Bitcoin goes to 100,000, they're like, well, God, if it goes to 200,000, I'll have even more money. And then, of course, it goes down to 20. And it's the same thing with a business. Like if you create objective markers and milestones of where you're supposed to be, and you don't get there within reason, and you're not listening to that evidence, you're just off the grid. You're no longer, now you're just like operating the business based on faith, which is a hard way to operate because the name of the game is never to have faith. The name of the game is to have no faith, to pivot your way to the right answer. So blind faith, irrational belief is like not an attribute you want to have.
So I'm hearing lay out a plan, markers, stick to it.
Yeah.
But also when the signal's clear, don't be afraid to
Pivot.
walk away.
Like, oh, I thought I'd be here. I thought I'd have 3 customers by 1 year in. It's 1 year in, I have 1 customer. I said 3 is the minimum I have to have. Okay, well, then your product doesn't and most people be like, well, I could have sold better. Well, I got really close these 2 times. At some point, you have to let something guide you when you don't know how to be guided. And I think we've institutionalized that. I don't need to lay out those markers now in building a business because it's like hardwired into my DNA for to want to interpret those signals in a real-time basis. And we kind of micro-pivot almost every day, at least early on. We're not micro-pivoting 8 years later because Tempest now is 2,500 people, and it's but we're micro-pivoting, in the first few years all the time. Every week, the business is a different business, slightly different business.
Let's talk a little bit about talent and how you bring people together. Over the course of your career, you've built several world-class teams. Any insights on how you find and bring together the best talent?
I'm laughing because Erin's here. I mean, she would tell you I'm the world's worst manager of people on the planet, and I literally
Find them though.
everything I've done in that regard, I would not suggest doing. Like, I have no advice for people in terms of like managing people's careers or developing talent. I'm horrible at all of it. The thing I think that the reason we attract so many people and the reason that I think we retain so many people is not because we're good at that, because I'm horrible at it. It's actually, I think, because in spite of being horrible at it, the problems we're solving are typically interesting. I think people believe we're going to solve those problems. People are excited to be at a place where they can solve those problems. And I think what ends up happening is we give people the freedom to do really good work. And so a lot of people will say I did some of my best work when I was at Tempus or when I was here, because I think we create open environments. They're apolitical. They're singularly problem focused. And we let people people that want to take the self-initiative love our environment. People who like the soft side of business, all the emotional stuff, like great job and whatever, not so great.
Do you want to comment on that, Aaron?
Yeah, not so great. I mean, I think that's not what we do well. It's a bit Spock-like and it's a bit problem-focused. But people, I think generally, we have exceptionally low attrition and people generally like it. But I'll say to people when they join, like, it'll be a bit of a culture shock for you. You're not going to get an email from someone being like, great job. Like, that doesn't happen a lot.
Common saying or wide-held belief, you need to be willing to take a lot of chances to find the right solution. Can you share an oh shit, fall flat on your face moment and what you learned from it?
Yeah, I mean, I have like a decade of that. So I don't have like one failure. I have like a decade of failure. So so it's not. I mean, most of my early career was a lot of up and down. I started a manufacturing company making children's apparel in the mid-'90s. That went out of business. We started a company called Starbelly that was sold to Halo. That went out of business. So my first two big companies went bankrupt. So I had a lot of failure early on. And what's interesting, one of the big things for me, and I think got better at certain parts of business, but one of the big aha moments I had in that journey was let's say with Inner Workings, I was having a ton of success, raising money. The company went public. It was growing like great. And then right before that, I had a failure. And I'm like, did I change? And I really realized I didn't really change. That it's also why we tend to be more model focused on investing than people focused, because I was the same person that failed and I'm the same person that succeeded. And one of the great lessons is it's very hard to fix a company when you're swimming upstream. And if you have if you're in an industry where there's natural headwind, I don't care how good you are, more often than not, you probably won't succeed. And if you're in an industry that has lots of tailwind, it is much easier to do quite well. So we try to avoid industries where there's natural headwind. So and my first business, I was making children's apparel, licensed children's apparel in the United States. So first of all, manufacturing was moving offshore. So bad place to be was opening a sewing factory in Wisconsin. That's a lot of headwind.
Can I find it online? Some Lefkofsky
Yeah.
fashions,
Yeah,
early fashions from the
long ago. And the other problem is that the leagues were all moving toward these master licenses. Now, back then they were going to Nike and Reebok. Today it's Fanatics. But if you're in an industry that's like troubled, I think it's very hard. So I think part of, as you're building a small business, if you start to feel like all the things you're doing you're just treading water, one of the things you should for sure think about is the industry in which I'm in or the model I'm deploying just filled with so much headwind that it's really, really hard. And if you can pivot away from that, I would.
And look where it's led you to, right?
Yeah, certainly when you pick the right industries and the right problems to focus on, it's a lot easier.
Okay, I'm going to guess there are a few people in the room that are interested in how you get access to capital to build the runway for growth. You've been able to do it several times. Any advice for those in the room in how you access the cash?
Yeah, I think first of all, I think there's a lot there. Like, I mean, in general, especially early on, when you're trying to raise capital, you have to paint a vision and paint, and kind of paint a story that gets people excited. It has to be concise, but it has to have people feeling like this could be really big. And I think a lot of people don't do that well. And I think working on doing that well is critical. The second thing you have to do is do it a lot. I think a lot of times people don't want to keep putting themselves out there to raise capital, but I would argue early on, especially early on, you should kind of almost always be in capital raising mode. Like we would literally at Tempus, we had an investor deck that never wasn't updated every quarter, and we'd raise money and start having conversations a week later about raising more money. All we were doing was raising, because at the end of the day, it takes a long time to raise money. People are always like, I'm going to raise money, and then I'm going to like put my head down and come up a year from now, and then I'll start talking to people again. Like magically, investors are going to be there waiting to hand you money. You have to just kind of always be in mode where you're pitching the dream, pitching the vision, and always be in mode where you're raising capital. And if you can get capital early on, you got to take the capital. And I would take as much as you can. People are overly focused on dilution, and it tends to also be a problem. And so I think you just want to hone your skills, refine your message, and do it a lot. And any chance you get to take the capital, take it. And I think if you do those things, at least you're probably set up more for success than the average company.
A lot of times that cash comes with expertise and advice. What's the best way to leverage the value of your funders?
Oh my God, I'm horrible at that too. I'm the world's worst at it. I'm the world's worst networker. I don't have a single mentor in my life other than my dad who's not here. Like I don't do any part of that. So I don't know the best way for people to do that. By the way, people love doing that and they do it well and it adds a ton of value. So I don't, but I just am wired to kind of, again, like focus on this problem at hand and solve it. I get most excited about connecting with people that see something I don't see as it relates to the problem I'm trying to solve, or people who think I'm an idiot and don't have the right answer, right? Like that is kind of how I like to engage. But I think in general, certainly leveraging anyone that can help you is a good thing. And I think it's kind of the same message, which is if somebody puts capital in, you want to be saying to them, who else can you introduce me to? Who can I meet? And just be in this constant, kind of motion of meeting new people and telling your story and meeting new people and telling your story. I'm in that motion today. I mean, as the CEO, I kind of, the vast majority of my time is CEO at Tempest. And then kind of after that, I have two other things going on that take up a little bit of time. One is I still Lightbank invests in a lot of companies. And then we have a company called Pathos, which is AI-enabled drug discovery. Takes up a little time. But I still today, I'm constantly pitching the Tempest story. Almost every day to somebody. I'm constantly talking to potential investors or clients or whatever. So it's a motion you got to be in all the time.
Never stop. Stay on the treadmill. Sell, sell, sell.
Well, I think, it's less about selling necessarily at some scale. It's more about, it's all sales, but at the end of the day, you're not selling like, give me an order today so I can run back with my order. It's more a function of when you're building something new and something disruptive, it takes a lot of inertia to bring people along with you, whether you need them as partners or friends or clients or whatever. And you kind of can retreat back into your bubble and think everyone gets what you get, but you got to tell the story over and over and over again. I'll meet with CEOs of hospitals or physicians that I've said, like for example, I say like, we're now one of the largest liquid biopsy sequencers in the United States. So we've been doing liquid biopsy sequencing for like 3 or 4 years. And yet I'll say to people, I'll mention that test, and they'll be like, you do liquid biopsies? And I'll be like, I just told you that every 3 months for the last year. And it's only time number 4 that it like a light bulb went off. And what most people don't realize is, when you're talking to someone who doesn't know about your business and they're giving you 30 minutes or an hour, it's in one ear and out the other. And the minute you're out of that room, it's like gone for 99% of all interactions. So when you got to pitch them over and over and over again until hopefully it resonates. Like,
You are living the vision every day. Even your dog knows it.
you're trying to bring everyone along with you, and most people are not coming along with you. They're doing their own thing. They have their own job. They have their own life. They have their own whatever. And it takes a lot of effort to bring them along.
Eric, can you share a little bit about the journey from founding a company to running a company at scale, and what have been some of the hardest transitions?
Yeah, I mean, I'm in a zone where I'm still building. I think of myself as a good builder and a good problem solver. So, and Tempus, even at 2,500 people, is still in build mode. There's a point when it kind of leaves build mode and really becomes more about manage mode, and then I am not the right person. So I'm not. Those aren't my strong suits. In fact, they're weaknesses. But and everyone's got to figure out that point where you no longer can do the job well.
How do you know? That's got to be hard.
I think it's objective markers. Like if the business is going well and things are moving in the right direction, then the odds are you as the founder CEO are still able to scale. But when you start having all kinds of problems, like, is it the business or you? And I think one place you got to look is you. And it is hard. I mean, most founders never want to let go. Most founders believe if they let go, the business will totally fall apart that day. And most founders have an irrational connection to that business as if it's it's the reason that they feel good about themselves. I'm lucky in that I don't have that. Like, I'm able to think I'm great even if I'm no longer connected to that company, and I don't see those two as like one and the same. And so, and I think, I don't know how you get that skill, but it's a skill you really want to have, because as a founder in particular, there should be a point where you're the wrong person to run the company. That's not the case all the time. Some business models are so good that the founder can have incredible longevity. But in general, the problems you have at $1 billion in revenue are radically different than at 100,000 in revenue. And there does come a point when other people probably can do something better than you. And being able to let go is a big deal. And I think it's when that should be more objective than subjective. It should be like, if things are going really well, then I probably am scaling. If things are going really, really badly, then the first place I would look as a founder CEO is me, and be like, can I bring in somebody else to help me do the things that aren't going well?
Interesting. You've shared a lot about what you're good at, what you're not good at. Do you think there's a certain phenotype that lends itself to entrepreneurial venture? And what are the characteristics that you think best set people up for success?
I don't know if there's a particular phenotype. There's lots of people that start companies in today's day and age. It's weird, when I was young, you wanted to be a doctor or a lawyer, or like that was it. There was no such thing as an entrepreneur. In fact, I didn't even know what the word, first time I heard the word, I think it was like 18. So now everyone wants to be like a tech entrepreneur, start a tech company, but back then it wasn't. So I don't know if there's a phenotype, because there's so many people that start these companies and have some amount of success. I do think there's a phenotype of people that are wildly successful, which is, in general, this is not an absolute, but in general, their tolerance for risk is pretty high. They're willing to take a lot of risk in furtherance of the thing they want to build. And I think people that don't have that gene tend to be more constrained. They still can be successful entrepreneurs, but when you look at some of the most successful companies, they kind of, at multiple points, bet it all, put it all back on the table, or a lot of it. And I think, again, there's examples where it's not the case, but more often than not, feeling comfortable taking risk at some point if you want to build something really big and really disruptive, is critical.
What would your mom say about you? Would she have known you'd be up on a stage here,
No,
driving change, starting companies?
No. I think I was always, I always had I was not great with authority. So I think she figured I would be doing something disruptive. Hopefully,
maybe in prison.
Yeah, hopefully not in jail. No, I don't think she would have seen this. We could ask her, but I don't think she would have seen this career path or this amount of success. I didn't see it either. Like I was, planning to. I went to University of Michigan. I was planning to go to law school. My entrepreneurial career kind of was weird. I had a friend of mine whose dad owned a carpet store, and like a week before we went to Michigan our freshman year, he said, "Why don't you? I got all these 12 by 12 remnants of carpet. Why don't you load them in the van and take them up? And if you guys sell them, you can keep the money." So we loaded up the carpets and we drove them up to University of Michigan, and we started selling them. And it was like minute 1, second 1, minute 1, second 1. I'm like, oh, this is what I was made to do. Like I got to be selling something to somebody who's going to pay me $140 for this thing that cost me very little, and then I can go buy, pizza or beer. So I had that aha moment where I realized that business was natural, but I don't know, the trajectory of my career is just weird, right? How did I get into technology? How did I get here? So there's so many twists and turns. It's hard to, and so much of it's luck. But at the end of the day, we're here.
Do some alumni in Michigan still refer to you as the rug guy?
I don't know. I don't know. We also had a company when I was, by the end of my term there, I ended up buying a company which became this children's manufacturing company, which owned the rights to a mascot called Willie the Wolverine. So I think some people refer to me as the Willie the Wolverine guy.
How do you stay motivated to keep solving problems and keep creating? Are there any habits that are key to your success?
No, I think because I'm so problem focused, it's all, you feel like there's never an end. I'm always trying to solve some problem, and so the financial success doesn't make the problem any less real. The problem is still unsolved, even though you have money. So I think that is a big motivation. I have a fairly balanced life that I think has allowed me to maintain some longevity. I never work the way a lot of people work today, which is round the clock. I always worked early and stopped early. I never was working at 10 o'clock at night. Like my schedule's been largely unchanged for 30 years, which is I get up early, 5 o'clock, 5:15, whatever, and I am done. Now I'm done working about 4 or 5 o'clock. Back then, maybe it was 6 o'clock, but I kind of go very hard 11 hours and then I'm done. And I never work on the weekends. So I always stopped at night. I always stopped on the weekend. And these breaks that you take where you just don't work, I think are really healthy. They allow your brain to just be clear, and you don't get burnt out, and you don't feel like you don't have a life, and you have some perspective. And a lot of times, having taken a couple days off, I'll have really clear thoughts because I haven't thought about business in 48 hours. Whereas I see other people just on this hamster wheel, and I think it's super unproductive.
Sage advice, and I think we could all benefit from hardwiring that into our lives early. Let's explore some of the next horizon of opportunity. What trends are you paying attention to, and what excites you as the next industry or area ripe for disruption?
I'm only paying attention to one because I think everything else is kind of semi-irrelevant, and that is generative AI. And I wrote a blog post on this some time ago. There's just nothing like it. It's just, at least from what I can see, and I've had really, interesting companies in multiple of these technology disruptive phases, whether it's the internet, whether it's social, whether it's mobile. I mean, we've had big companies in all those technology paradigm shifts, but for me at least, it feels like they're all tiny compared to this. This one feels like it's different, and so we spend an enormous amount of time at Tempest thinking about how generative AI and in particular LLMs are going to change what we do for a living. In fact, we've really over the last year largely migrated most of our technical staff. We have about 1,000 technicians, about 600 or 700 software engineers, and about 100 AI engineers, about 250 PhDs and 50 MDs. So it's a fairly large technical team. We've migrated lots of that team to being singularly focused on LLMs, building LLM agents, deploying these agents, figuring out how this stuff changes. Because in a world of generative AI, the two most important things to have for a particular business model is access to a proprietary data set, and then the ability to distribute insights from that data set, or the models you generate off that data set, into your end client. And Tempest just happens to be like sitting at the epicenter of two of those, in that we have this massive proprietary data set, probably the largest in the world that we know of, and we can distribute it to thousands of doctors in real time, all the time. And so we think a lot about how generative AI is going to change our world, change healthcare, change other industries. But I think this is the foundational, it's like kind of a pun because foundation models, but this is the foundational technology that I would be paying attention to.
And is there any industry it doesn't apply to?
I mean, in terms of having some impact, it affects every industry because it probably affects like the workflow of a lot of industries. But it will have a more meaningful impact on any industry where the ability to interact with vast amounts of data and have that data be expressible to generate some kind of consumer insight or business insight is a differentiator, which is most industries, right? So, and that's where generative AI is going to be game changing, and that it's really the primary difference for those that don't spend a lot of time with it. The great aha moment here was it was the first time these massive data sets that could historically be queried could actually be presented in a way that the average person could interact with them. That's the foundational change, right? It's not that there wasn't natural language processing before, there was. And so, yes, an LLM is a more exquisite form of that, but it's this radical shift of being able to train these models to interact with the end customer or the end user in a way that feels unbelievably human, and therefore allows you to pull unbelievable insights out of that data in a way that the average person couldn't do. Maybe a highly trained, data scientist could do, but certainly the average person couldn't do. So you bring the kind of benefits of engineering and data science way up the chain, and that's what creates the huge opportunity.
Potential. Okay, we are coming up on time and are about to open it up for questions, but I'll wrap with a final question from one of my favorite visionaries, Barbara Streisand. If you had the chance to do it all again, would you?
Yeah, I mean, yeah. Including the mistakes and the failures and the errors. I mean, it makes you better, and so I don't have any like regret about the stuff we've done. There are certain business lessons that I have learned that I would not want to recreate, and I tend to think a lot of business at some point, I think it's almost like a lemonade stand. You know, it's very simple. You want to repeat the things that worked well and do the opposite of things that didn't go well. So there were certain things that happened with Groupon that didn't go well. We grew too quickly internationally. We went public too quickly. So like you look at those things, you say, okay, if I'm going to do that again, no matter what the company is, I don't want to do that again. I'm going to grow slower internationally. I'm going to go public slower. So we've made those decisions at Tempest. But in general, I have no regrets, and most of it allows you to create, lessons that make you better.
Eric, thank you for the time and the insights. I think everyone's leaving with a pocket toolkit for success. I think we are going to open it to the audience for questions. So if you have one, raise a hand and someone will come your way with a mic.
Should I go?
Yeah, go ahead. Do you want to stand up?
Yeah, sure. Hi. Sorry, I don't know the answer to this. Are your companies all based in Chicago? And is Chicago a good city to build tech companies?
Oh my God. So I'm like horribly blunt, and so I have to like put on like layers of filter to make sure I don't say anything inappropriate, which I only want to say. Okay, first of all, yes, all our companies are in Chicago. That part is easy, and I would say Chicago should be an amazing place to build tech companies, and has the potential to be an amazing place to build companies, but also quite often can't get out of its own way. And in particular, some of the things that I think it does horribly badly is it has a culture that seems to love when people fail and hate when they succeed as it relates to taking risk in technology. Not necessarily other industries, but it doesn't have that, it's not hardwired to want to support tech companies. So for example, the first article I ever read about Grubhub was when their stock went down, right? I mean, 5 years of like killing it, never a peep. But like the minute they had a problem, whoosh, big article. So, and there's other examples of that. And so I would love Chicago to recognize that it is the great Midwestern city and it has incredibly talented people, incredible universities. It should be the third largest tech hub in the United States. It is not by a long shot. It should be. And I think the only thing it stands in its way is itself. So the answer is it should be. Most of the time it is. Sometimes not.
But through great conveners like mHUB,
Is that okay,
it's
by the way?
going to change.
Iffy.
Okay, I think we had a question coming over here.
So it sounds like you've had great success building multiple companies here, despite maybe a few headwinds. One of the keys to scale is finding the right people to get on the bus. Do you have any great advice for how to find the initial team when you start these new ventures in Chicago or elsewhere? How do you start building that initial team that helps grow and scale real fast?
Yeah, I tend to think the very thing that helps you raise capital is the exact same thing that helps you recruit your first 1 or 2 employees, which is, what do you want to build? Do you have a vision for it? Can you articulate it? Do I get excited? Like, people who join companies or people, it's like especially early adopters, right? The employee number 1 or number 2, or early stage venture capitalists, they want to believe, right? And so you'll see it when people are pitching, like when people are pitching me an idea that's really unbelievable, I get almost fidgety. Like my legs start tapping. I'm like, you almost want to like jump out of your skin and say, I want in. And creating that is not easy, but I think that's what you have to create. You have to convince people that what you're building is going to be amazing. Otherwise, I'm not going to take that leap of faith and join you. So you got to, and by the way, like that part of that is practice. Part of it is the hard work to distill your message, but part of it's also, make the pitch to anyone who will listen. Make it to your girlfriend, your wife, your friend, whoever. Just make it. I don't know. I'm not in control of Gui.
Hi. So you mentioned that you need to be ready to pivot, and if the data doesn't look like it's headed in the right direction, then you need to be ready to pivot. What happens after you make that decision to pivot? What does that process look like once you decide that maybe you're not headed in the right direction?
Yeah, it's an exact same process, which is, so you say, I think this is what people, and by the way, when you're starting a company, you're trying to solve some problem, you're trying to build some product, but ultimately you're trying to figure out if there's product market fit, meaning will somebody buy the product you have just made? So you make that sale, or you deliver that first product, or you build that first product, and then you have some metric of like, oh yeah, this is resonating, there's adoption. If it's not there, and you have to create that objective metric. Like, for example, I'm going to launch this new website. If we can't get 10,000 users in 6 months, it's not working. Okay, 10,000 is the number. So now you launch, you deploy, you're at 1,000 users. Like, something is wrong. It's not, there's no virality to your product. So then you're like, God, I think this sucks. We should change this. You make the change, you set the next marker same way. All right, if we can't in 90 days get 5,000 users, this change didn't work. And then if that doesn't work, you pivot again. You constantly are letting some objective buoy in the water tell you if you're going the right direction.
Thank you.
Thank you so much, Eric. That was amazing. Thank you, Kristen. Thank you. It's absolute honor to have you kick off, be our first official keynote. So big round of applause here.